So, Hannah, if you could summarize your image of nursing into one word, what would it be?
It would probably be helpful because I think that's really what nurses do. They help people, and doing that, they help themselves.
Very cool. How has an interaction with a nurse made a difference in your life?
Well, my mom's a nurse practitioner, so I interact with nurses every day. And whenever I go to work with her, all the nurses are really nice and they're very helpful. And whenever I need a checkup, they're always there to help me.
Do you have any recommendations for future nurses?
Don't be afraid of anything because people will ask nurses, especially when they come to the doctors, for literally everything. I've worked at a doctor's office, and just to be ready for anything.
Very cool. Thank you.
You're welcome.
So, Hannah, what do you think nurses do? What is their primary job?
I think nurses' primary jobs are basically to really just be there for the doctors, whether they need an assistant or whether even if a patient needs to be calmed down or someone to talk to other than a doctor. I think nurses are to be there for them and also just to be the doctor's assistants.
Do you think that nurses have any say in what the doctors do, or is it just the doctors that make decisions?
No, I definitely think that they have a say in what they do. Working at a doctor's office and my mom being a nurse practitioner, doctors usually say, what do you think about this, or is this a flu or is it not? Do you see a pink or blue strip for a pregnancy test? They're usually asked questions and definitely have a say in what goes on.
All right. Where do you think nurses work? Do they only work in specific spots, or where do you think they work?
Well, I think it kind of depends on what the specialty of the nurse is. A nurse might have a specialty, maybe like drawing blood, so they're always asked to draw blood, or maybe there are special x-ray nurses. I don't know if there are x-ray nurses, but maybe they work there. So I just think that they work wherever their specialty is.
So, your mom works in doctor's care, correct?
Yes.
Do you think that nurses only work in places like that, or do they work in hospitals and other care facilities?
Oh, they definitely work in hospitals. In hospitals, I'm pretty sure they're called mid-levels, which I know what my mom is, and they definitely work in other places. I mean, nurses are pretty much needed everywhere in every kind of care facility.
And finally, our topic for this project is nursing shortage. So do you think currently there is a nursing shortage?
No, I do not think there's a nursing shortage. I think every place, pretty much has a good supply of nurses, and with nursing being such a big program at almost every college, I don't think there's a shortage, but I definitely think that there's no problem if we have more.
All right, thank you.
You're welcome.